I welcome you back to the next session by Dr. Rohini Karunakaran. So it is a medical education topic, that is integration of basic medical sciences in medical education. So the next topic is by Dr. Rohini Karunakaran, our speaker. She is Associate Professor, Biochemistry Unit in AIMST University, Malaysia. I also welcome our chairperson, that is Professor Dr. Medha R. Welcome you, ma'am, both of you. She is Professor, Department of Biochemistry, Associate Dean, Research, JIPMA. She got her MBBS in 1997, Mysore Medical College, MD Biochemistry, JIPMA, Puducherry, then DNB in the year 2003, and also MNA MS from the National Academy of Medical Sciences, and Madam is a Famer Fellow. So other responsibilities is Madam is having is, she is the Member Secretary of Institute Ethical Committee. She is Associate Dean Research from the year 2019. She is a resource faculty of MEU from 2017. She is South representative of ACDI and AIBS. Professional achievements and awards. So Dr. G.P. Talwar Mid Career Scientist Award for the year 2017 from Indian Immunology Society. Kusum Sharma Award for the Young Women Scientist. STS project guided by Madam was awarded the ICMR CNMC's STS Excellence Award in 2019. C. Chudiwala Endowment Medal and Prize for being the best outgoing postgraduate in medical biochemistry, MD in 2002 from JIPMA. Then NMA Scroll of Honor and awarded the membership of National Academy of Medical Sciences in New Delhi. So rapid grant for young investigator scheme from DBT is an extramural project for psoriasis genetics in 2012. Involved as a resource person in several workshops in capacity building, research ethics, DBT nominee for the Institute of Biosafety Committee at Vector Control Research Institute, Puducherry, member of Committee of Expert to address the task force on vitamin D deficiency in India at DBT, several grants from SCRB, ICMR, DBT, more than around 100 publications are there, and total citations, that is 2,580, having a H index of 29. So Madam's research interests are cutaneous immunology, CKD biology, and medical educational research. So welcome you, Madam Ma'am, for this, to chair this session. And I also welcome Rohini Ma'am to deliver. Thank you.
Thank you very much for that very generous introduction. It could have been more brief. Anyway, I would like to introduce Associate Professor Dr. Rohini Karunakaran. It's a pleasure to introduce you to this August gathering, ma'am. She has a very illustrious CV with an MSc in Biochemistry, MPhil, BEd, PhD in Biochemistry, MBA in Educational Management, several certificates. She has done essential skills in medical education leadership and SME lead, AMI, PG diploma in medical education from Dundee, UK, associate fellow of AMI, PG DMLT, PG DCFS. There are so many fellowships which Madam has. I think it's really an honor to have you and introduce you to this August gathering, ma'am. For want of time, I'll keep it brief. Madam is the Preclinical Co-ordinator and MEU Co-ordinator, Faculty of Medicine at AIMST University, Malaysia. She is also the Risk Committee Coordinator, the ISO Steering Committee member with a teaching and research experience of more than 20 years, several international awards and winner of the Young Scientist Program Fellow, Seoul, Korea. Madam has around 62 publications, 7 patents, 6 books, 10 book chapters, editorial board member of several journals, reviewed more than 150 articles, presented several papers, invited speaker and resource person for several international conferences. A pleasure indeed, ma'am. Welcome, Dr. Rohini Karunakaran. I don't want to stand between you and this August audience. Welcome, ma'am. I invite you to deliver your lecture on integration of basic medical sciences in medical education. Having an interest in
Thank
medical
you very
education
much, ma'am.
myself, looking forward.
Thank you so much, ma'am. I'm so glad that you're here, ma'am, with biochemist, with a specialization in biochemistry and medical education. It's a proud thing for me to present it in front of you. Thanks for the opportunity, ma'am.
Over to you,
Over
ma'am.
to my presentation.
Take it away.
Sorry about that.
Do you need help, ma'am?
It's visible.
Yeah,
Make
it is visible, ma'am. Maybe you can go to presentation mode, ma'am.
Yeah, slides here.
Yes,
Slideshow mode.
I think just got hanged. Sorry about it.
I think we are on time, ma'am. You can take your time.
Okay, ma'am. Is my screen visible, ma'am?
Oh, yes.
sir.
Okay. Thank you. So it's my honor to be here, and thank you for inviting me for this international conference. And I'm presenting on the integration of basic sciences and medical education. So that has been quite challenging. That has been, is my slide okay, ma'am? I'm sorry to
Ma'am,
interrupt again.
can you please go to slideshow mode, please? If it is possible, please.
Yeah, sure. I have a double screen, so probably got.
Slides are visible, ma'am, but they're not in presentation.
Yeah.
Sorry to
I guess should
interrupt.
be okay, ma'am. Sorry, ma'am. Is that okay, ma'am?
Not yet, ma'am. It is.
Ma'am, go to the display. Ma'am, go to the display settings, ma'am. Upper display settings, you just go. If it is the double mode, just share once more, ma'am.
Manju, ma'am, do we have madam's slides? Will it be
No,
possible?
no. Actually, ma'am has not sent it, ma'am.
Okay. No
1
problem.
minute. ma'am.
Is it okay now?
Now, actually, ma'am, now you just click on the full slide, full screen. Ma'am, now you go to yes, ma'am. Now you swap the presenter view and slideshow. Yes, yes.
Fantastic.
Okay now, ma'am.
Yes, ma'am. Go ahead, ma'am. Go ahead.
Apologies for the inconvenience.
No problem.
Thank you. So I'm taking you through the basic science and academics. So I'm talking about integration of basic sciences and medical education, our experiences and lesson learned for our new curriculum. So to take you through the curriculum, so we all know curriculum is a blend of educational strategies, course contents, learning outcomes, educational experience, assessment, educational environment, the resources that we require, and the students' learning style, our schedule, and the program work. So that is what we expect our thing, which has educational strategies, which is teaching, learning, assessment, and then the resources that is required, the learning styles, and so on. So curriculum is basically a blend of this, as we all know from Hardin. And curriculum is basically the aims and objectives, the content and outcomes, which basically we expect the students to know about the knowledge, skills, and behavior that we expect them to achieve. So talking about curriculum as such, it is very important that curriculum, it involves the academic staff. The curriculum of practice is a plan that includes a set of guidelines and procedures to help the students understand, generalize, and transfer the essential knowledge and skills with discipline-based practices and problems. So basically, the student function will increase with skill and competency as a scholar, researcher, problem-solving skills, and as a practitioner in a medical education. So this is being a thing, and the wide challenge of our curriculum is we have different phases of curriculum, which has a planned, learned curriculum, the taught curriculum, and the assessed curriculum. And the most important is the hidden and the informal curriculum. So with a wide spread of concern about the clinicians and medical educators, that basic sciences knowledge must be integrated into the traditional preclinical years, because they believe that the preclinical years have substantially lost by the time the medical students reach the clinical years. So there is a decline in the retention of the preclinical subjects that they have learned. And it's a very important thing that the basic science disciplines has to be reinforced. And constructive alignment is where it is an alignment between what we want the students to learn and what we teach and how we assess the teaching. So that is very important. So integrated curriculum, as we all know that basic science educators are not always clinicians, and we expect the clinical application in the preclinical phase. So the practice of facilitating curricular integration is to create exponential experiential opportunities for basic scientists to observe the clinical application and their content to pair with the initiatives and training in effective and medical education practices. So as we all know, integrated curriculum is a fully synchronous transdisciplinary delivery information from the foundational sciences, the basic sciences that we call as the foundational sciences, and the applied sciences, which is taken throughout the years of medical curriculum, and teaching of different subject areas in different disciplines and emphasizing the role of clinical subjects throughout their curriculum. So we strongly favor the true integration of both horizontal as well as vertical curriculum in our interdisciplinary synthesis. And it is not just the coordination, it is not departmental or subjects that is integrated. So we also follow the same thing of interdisciplinary synthesis involving the integration of the subjects into the curriculum as a wholesome process. So we have the horizontal curriculum and the integral curriculum. So horizontal is information taught in the same curricular phase, is taught together and is usually focused on a theme or a problem. And vertical curriculum is taught in different curricular phases, is taught together and is usually focused on the clinical theme or problem. So we have both integral and vertical curriculum where the basic sciences and clinical sciences are spread over and the behavioral sciences is also assessed. So there is a trend in the modern medical education designed to basically integrate the basic sciences and clinical sciences. So when we talk about integration of basic sciences education into clinical application, and the initial stage of learning is very important because it improves retention of information for the students. It facilitates a transfer of knowledge to the clinical setting, what they learn through the basic to the clinical setting. So therefore, the concept of integration is, however, not new in medical education. However, there is quite a number of challenges. We have to have curricular changes in the undergraduate medical education program, which is quite challenging in any institution as such. So in medical education, it is hard to change the existing curriculum. So we have a traditional curriculum or an integrated curriculum, which has to be enhanced. It is quite challenging for us to develop from the existing curriculum, because we need a lot of resources, we need a lot of staff and student stakeholders meeting, which need to be understood, and then also the change process that is essential. So integration of curriculum in medical school is meant to be teaching learning activities. It's meant to make the teaching learning activities quite effective and meaningful. So with this in mind, so basically following the hard and spices model. So why are we moving into integrated curriculum? Because of the spices model, because we are no longer focusing on teacher-centered mode. We are focusing on student-centered, which is outcome-based education. So talking about outcome-based education, we want to know what the student has learned, what the student has achieved. So we follow that through a number of forms using this model where we want the information to be learned. They cascade the information. They also do teamwork and other foster activities and skills that they will do. They will be involved in problem-based learning, which is more enhanced for them for clinical scenario-based learning. Integration of both basic sciences and clinical sciences. Community-based learning, which is not just within the thing, it is within the community. And electives, in which it is elective-driven and it is in a systematic way. So integrated curriculum has attracted attention, and it is very important for us to have a basic sciences integrated into the more medical curriculum. So talking about integration, we have integrated teaching, we have integrated assessment. Are we teaching and are we assessing the same? So talking about integrated teaching, there are several strengths that has been observed based on the SWOG. First, talking about the strength, the integrated teaching, it helps to identify the relationship amongst ideas and concepts and topics for the students. So it helps in networking, it helps in reactivating the processed information. It adds value to the complexity and durability of acquired knowledge. It helps the students to encourage communication, problem solving through cooperative teamwork. And they assign a role as a facilitator to the teacher, which remains as a source of information. And they develop the ability of the teachers to integrate curriculum in achieving proper coordination. So these are the strengths in achieving an integrated teaching. However, there are weaknesses which could be observed. So a latent or resistant to the teacher teachers to an integrative trends, difficulty in preparing the educators, which is quite an important challenge in the current thing, to adapt the lecturers, the staff to get into the new curriculum. So difficulty in preparing the educators to teach the integrated way, and the lack of best practices example, and students' failure to acquire more in-depth knowledge. So it is more breadth than depth in integration, which is a very important weakness we found in the integration curriculum. So what are the opportunities that we can face? Achieving a lateral transfer of knowledge that is required, achieving of genuine blending between the natural and rigorously structured learning, autonomy to pursue effective integration, raising awareness among teachers, which is very important because they are the one who will be integrating, communicating with the students to enhance the curriculum process. Incorporation of ethics into the curriculum, into the problem solving system, and all the other outcomes to be achieved by the student, and the insertion of non-formal and informal education in formal education context. So these are the opportunities which was found during the curriculum review. And we did have a lot of changes and challenges that we had to undergo. So we had cross-curricular teaching for both students and teachers. So to specialize encyclopedic learning paradox. So we learn a lot through an arrow focus group thing. Example, in MBBS year 2, we have PBL sessions. So each system PBL, example, cardiovascular system, we have 2 PBLs per system. So each PBL contributing to 3 sessions for students and 1 review session. So the 3 sessions are held for learning, for them to focus on their teamwork, for focus on the communication skills, and all the teamwork, communication skills, all are enhanced. And then we have a review session where the clinician comes in, gives in the clinical input for about the case. It could be a cardiovascular case or a nervous system or whichever the case it is. We have a clinician inputs for a review. So we have 32 PBL discussions for each system. And it is found to be very effective. However, we did have challenges because of the number of PBL discussions. And integration also may violate student-centered learning, which has been quite an important challenge for us. There was unaware and oversimplistic generalization among the systems, among the staff during the review. So basically, we had MCBM, which is molecular and cellular basis of medicine, versus the system, the subject-based individual disciplines in the curriculum. And slipping into an integrated disciplinism was a very important challenge for us. And balancing, as we said, we had a balance of basic sciences and clinical sciences, which had both horizontal and vertical integration. So these are the challenges that we had faced during the integrated curriculum from an old to new one. So we understood, we did the SWOC, which had a strength, weakness, opportunities, and challenges for our curriculum implementation. So we all follow the stepwise development of integration, which is our Hardin's integration ladder. So we were following this sequential step of development of integration. As we know, Hardin has made it clear that progressive nature of integration from one step to next is very important for us to integrate the system. So integration is truly bound to the progress of the ladder. With this in mind, we had the integration for the basic sciences as well as the new curriculum. So when we're talking about teaching of integration, are we assessing the same way? Are we assessing the questions? Are we assessing the students in an integrated format? Yes, we do assess. It is an integrated assessment in medical education is also a very important factor when it comes to integrated curriculum. So when we say integrated curriculum, it needs integrated assessment. So integrated assessment in medical school, it is mainly to provide engaging and creating a learning platform which will link our students, our doctors into real life experience. And integrated assessment is a process which will combine the learning outcome, the blending of the learning outcome into the different modules that you have learned, into different systems that they have learned, which is streamlined, realistic, and case-oriented, which is very important for a medical student. And the assessments are conducted over a period of time, which includes both formative and summative components. And assessment is no longer taken into final examination. There's no traditional assessment model, but it has a realistic method of case-oriented assessment with formative and summative components. So there are different types of integrated system. We have formative, summative, we have simulation involving OSCEs, and then we also have hospitals, experience of a real life doctor with an integration system. So as we know that assessment strategies involves authentic assessment, performance assessment, systemic observations, portfolios, and journals. And we follow this assessment strategies for our new curriculum. So what are the rubrics that we use for integrated assessment? There are different rubrics that was used. We had to measure the outcomes based on the real life criteria using case scenarios. We had specific performance indicators for the students, and we made sure that the assessment was consistent to improve the quality, and we also had ways to improve the quality of assessment. So when we say integrated curriculum, the curriculum must be integrated, the teaching is integrated, and hence the curriculum must also be integrated. So to take you through what we had in our old curriculum and what we have in the current curriculum, earlier curriculum, we had year 1, which is classified into 2 themes, which were molecular and cellular basis of medicine, which we call as MCBM. And we also have HBM, which is human basis of medicine. So MCBM, we cover the structure, function, and diseases of the organ systems, which is taken through year 2. And MCBM acts as a scientific background to that. And HBM introduces the students to the society, the patients seeking healthcare, ethics, EPI, and all this, which for HBM. So for year 2, we get into the system base. This was the old curriculum where year 1 was MCBM, HBM, followed by various systems like cardiovascular, respiratory, gastrointestinal, central nervous system. First, clinical attachment, where the student gets to go into the hospital to get knowledge on the clinical attachment. Biosafety module, musculoskeletal system, endocrine and reproductive system, renal and hematology system. So this was our old curriculum with the basics in year 1 with MCBM, HBM, followed by systems in year 2. So the phases of MBBS program, so basically was the phase 1 program was arranged as a series of systems, which is to build the knowledge and skills that they have learned in the previous elements or modules, which provides a basis for knowledge and skills essential for learning the later modules and phases. So as the student progresses through time, they are designated with more of self-directed learning, which we call the SDLs, which gives a more greater responsibility to manage their time and to learn. So what did we do in the new curriculum? Our new curriculum was completely an integrated organ-based system. So we had the first phase, which is the first 3 months of 12 weeks with an introductory module for basic sciences. We call the introduction to basic sciences. And we also have 2 weeks of primary care during the year 1. However, in the systems, the phase 2 is completely system-based, which is spread across from year 1 until year 2. So the phase system starts from cardiovascular system from year 1, and it continues with respiratory, gastrointestinal in year 1, and continues with nervous system, endocrine, integrated modules in year 2. And they also have the first clinical attachment, which is 6 weeks of earlier exposure to the wards. And they also have integrated system modules to complement the understanding of interaction between all these systems. And they are assessed at the end of year 2. Earlier in our assessment also, we had assessment at the end of year 1 and also at the end of year 2. However, the integrated organ system, which is a new curriculum, we assess them at the end of year 2. And we also followed the RHYME framework, which is adapted for our curriculum to provide a structured progression to the clinical years. So in basic sciences, they report. In year 1 and year 2, they focus, they report, and year 4, they interpret, and year 4, 5, they manage, and year 5, educate. So this is how our curriculum overview goes with in the basic sciences followed by clinical years. So our curriculum review overview is recorded for professionalism and ethics throughout their program. And in academic years, year 1 and 2, integrating of core knowledge through the system-based approach, which starts in year 1 and continues with year 2 and assist in year 2. And academic years with junior clerkship, developing clinical skills, interpretative and communication skills in year 3, 4. And academic year, the senior clerkship, the shadow houseman in year 5. So in year 1 and year 2, they integrate the core knowledge of human organ system with a graded learning to the clinical years, acquiring knowledge, interpretative and communication skills using RHYME framework. So how was the integration? As I mentioned, we had an integrated organ system. The teaching learning, integration of teaching learning, we had PBLs. Example, being a biochemist and a medical educationist. In biochemistry has been integrated into all the case scenarios of our PBLs, which is a part of integration. And we had symposium in which the students' activities are assessed, assignments, which is also a part of assessment, formative, and laboratory sessions where they can integrate and link the clinical scenarios, which has been supplemented all this by the lectures. So basically, the integration of teaching learning is to complement and reinforce learning, bridge the gap, and also to enhance the students' teamwork, critical thinking, communication, and to manage time by self-directed learning. And how did we do the integrated assessment? Using formative and summative assessments. We had clinical scenarios integrated in extended matching items, MEQs in case scenarios, and also in symposium. So example, as a biochemist, we had biochemistry. We had biochemistry integrated into the PBLs. We had biochemistry learning about musculoskeletal system. We had the biochemistry pathways into musculoskeletal system. When it is cardiovascular system, the lipid metabolism and the cardiovascular diseases associated with this were integrated in cardiovascular system. So teaching and learning with lectures and PBLs were involved, and biochemistry was integrated into various systems with their importance and relevance to their clinical learning. So we did have quite of challenges when we did the new curriculum. The resistant to change, they were quite adopted with the old curriculum. So the staff requirements, the staff adapting to the new change was quite resistant, and we had quite number of challenges for that. And adequate number of staff, the staff retention was the retention was quite different, and so there is not adequate number of staff during the curriculum review. We did manage, and it was quite challenging. The time required with the current curriculum going on, we need to put an extra time to develop a new curriculum. So the time required, the extra workload, and the infrastructure and resources, the PBL classrooms, the resources that is required, the meetings, the stakeholders meetings, all this required resources and infrastructure. And finally, the documentation. Our documentation is through the MQA, which is Malaysian Qualification Agency, which is our approval board. So we had to document each of our curriculum updates with the phases, with the stakeholders meeting, with the feedback and all this, which is quite a challenging one. And the resistance to change, how did we solve it? We had a resistance to change. However, we had a number of faculty development programs conducted, and we had stakeholder meetings and reviewers which was conducted, which was also a part of enhancing for promotional exercises. And so the solutions that we had is more part-time staff, recruitment of more staff, intensive recruitment process to balance the staff, time, workload, and sharing faculty resources with other faculties was a very important one. Involving blended learning was quite an important thing. And we also have different methods of teaching learning, which also includes a reflective portfolio where the students give the feedback for every system, every module. And we did achieve the new curriculum with committed and trained staff and extensive documentation at each stage of our MQA approval. So the lessons that we learned are, with the new curriculum, the staff and students are happy because they can reinforce all the outcomes that the students need to achieve and the staff are able to deliver. Of course, it was very important to motivate the staff to move into the change resistance and get into the new curriculum. We had to promote staff with incentives which is very important for the staff workload, and staff training. We had faculty development programs which was conducted for the staff, and the student involvement. All the feedback process was taken into account for the new curriculum, and with the support of management, we could achieve the new curriculum, and these were the lessons learned for us. And so the key concept that we learned was clear understanding of integration by the planners is very important. So the set of goals and objectives must be determined and agreed upon by the staff and the students. And implementers should be involved in planning. A sense of ownership and commitment to the plan for new curriculum is essential. Interdepartment committees, medical education unit was highly responsible for managing the segments of curriculum and interacting with the various disciplines and departments in enhancing the curriculum. And we also had other attention was played to the test items, student assessment procedures, because it's not just the teaching and learning that was implemented. It is also the assessment. We had integrated assessment, which is a way to enhance students' outcomes, and several strategies was applied to advance to the students' learning, achieve the student learning outcome. And the most important key factor in doing all this was by faculty development program. Faculty training was essential for successful implementation of the new curriculum, and a program evaluation plan was developed before the implementation commenced. So to conclude, achieving the curriculum through a logical sequence of integration of basic sciences into clinical sciences is quite challenging. However, several measures have been taken with faculty development programs and feedback stakeholders meetings to enhance the curriculum. So a clear understanding of the concept of integration is needed to link between the different disciplines, which is essential for the student, because the student are the learners, which has to be attained by the curriculum planners and implement to promote the real integrated learning. So faculty development program, it focuses on the crucial characteristics of highlighting the links between various disciplines and must be conducted from the outset of the curriculum planning exercise. And as a medical education unit, we had to conduct a number of faculty development programs. We did monitor the curriculum review process, evaluate the program, conduct regular curriculum interviews during the survey and feedback, not just from the staff, from the stakeholders, from the hospital staff, from the students, and so on. So that we achieved the new curriculum, which is the integrated organ-based system, both in teaching, learning, and assessment using basic sciences integrated into the clinical phases with clinical scenarios. Thank you. As we all know, learning is by connecting things. If we cannot connect, we cannot learn. As Lord Churston said, I would like to acknowledge our dean for all the support. Thank you. Sorry,
Thank you so much, ma'am. Am I audible?
Madam, ma'am, you are muted. Madam, ma'am.
I'm really sorry. I'm a little tech challenged. Kindly put up with it. No, I would just like to congratulate Dr. Rohini for a wonderful account of all they have achieved there. Before I forget, ma'am, kindly convey my regards to our guru from NTTC, your professor and dean, Professor K.R. Sethuraman. He was my co-guide. I had the privilege of having sir as a co-guide during my post-graduation at JIPMA. Please give him my respects and namaskar.
Sure, ma'am. Thank you so much. He was a main instrument in doing this curriculum review process.
I can imagine, ma'am, because we have worked with Professor KRS, so it's indeed a pleasure. But I really want to appreciate and congratulate you for this mammoth effort which you have put together. Of course, the way you said it, it seems all rosy, but I am sure that it must not have been very, very easy for you. I am sure that there was a lot of initial resistance from all these stakeholders involved. The take-home message for me was the way in which you involved all the stakeholders, put them together, gave them ownership of the entire process, starting from the university authorities to your staff, the faculty, the students. I think you involved all the stakeholders, and that is why probably you were quite successful in whatever you had done. But ma'am, I have a couple of questions for you, if I may.
Sure, ma'am.
Actually, you mentioned regarding the integrated assessment. Actually, the integrated assessment, like you rightly said, is not very familiar to all of us. Because what you are doing is you're putting new systems into place. And that too for assessment. Assessment is the most important part of learning, because they say assessment drives learning, as Peter once said. So the assessments, what you put together, how did you arrive upon the final consensus on these are the methods which we are going to put together for the assessment? How did you validate it before you implemented it? Of course, you had put together a group that you reached a consensus, and therefore later you had FDPs and trained your staff. That is understandable. You did mention regarding the methods you used as well. But how did you arrive on this is the ideal way to go about the assessment to achieve the outcomes which you set out to do? Because definitely all of us agree that the objectives and the outcomes need to be aligned.
Okay, ma'am. Thank you for the question, ma'am. So integrated assessment is much more challenging than teaching, because as you know, we have different methodologies for teaching.
Absolutely.
But integrated assessment, how did we do is we had MCQs, EMIs, which is paper one, which was for assessment, and MEQs is clinical scenario based. So it was not based on a traditional mode of using a subject based. It is not biochemistry or anatomy or physiology that we brought in. It was a theme that was brought in. Example, if it is an acute kidney injury, if it is a theme, and with the theme, we prepared the questions. We had a unit team of ME unit members and the head of units of all the subjects, where if the theme was set in, and for jaundice, example, if it is jaundice. So jaundice, what is a possible anatomy that could be linked in? And the question was integrated with one another. So that is how we prepared for assessment, ma'am. Same goes for MCQs
How
and
did you
EMIs.
validate it?
Yeah, validation we did.
How did you validate it?
Yeah, true, ma'am. Validation was quite challenging. We did the validation through stakeholders, where we interacted with them. We did reinforced learning with the students. We gave practice sessions and review sessions. We do have mock, which was given as a feedback for the students, and the feedback were taken from the students as well as the staff for validation.
That's really interesting, ma'am, because when you set out to do something new, they say that you need courage to lose sight of the shores in order to go delve into the depths of the ocean. I really congratulate you and your team for that. I just have one more
Thank you,
question
ma'am.
before I open up the floor to the people who are online. Ma'am, you did mention regarding the 32 PBLs which you had designed for the discussion of each of the systems.
Yes,
I'm
ma'am.
really, my hats off for this, ma'am, for doing it.
Okay.
I'm curious to know that this 32 PBLs were over a period of 2 years, if I understand.
Yes, ma'am. Example, if it's a cardiovascular system or a respiratory system, example, the respiratory system, each system has two PBLs. So each PBL has 6 hours, which is per PBL has 2 hours session. And we have 3 sessions per PBL. So which is 7 hours per PBL. So each system having 2 PBLs. So cardiovascular, respiratory, gastrointestinal, and then nervous system, musculoskeletal system, immunology and hematology. We have all the modules with PBLs, with 2 PBLs for each, ma'am.
It is over a time frame of 2 years, ma'am, because this will
Yes,
require
ma'am. It starts.
feasibility of time, infrastructure, faculty, everything being put together. So that's why
Yes,
I'm
ma'am.
trying to understand the logistics. If somebody wanted to replicate what you have done, we need
Yes,
to at
ma'am.
least understand how the logistics works. So that's why this query, I think it was over
Yes,
a
ma'am.
period of time, right? It was 1 year.
2 years, ma'am. 2
2
years, and each system has 2 PBL. So how we do it is it's for small group learning also, ma'am. Like in a lectures, all the 150 and 200 students sit in a class. So that is by lectures. But however, in PBLs, our main aim is for their teamwork, their communication skills, and their interaction. So we have a small group for PBLs. Example, in our PBL group, each group will have 10 to 15 students only. And we have lecturers each for every group. So every group will have example 150, and even if we group them 15, we have 10 groups and 10 lecturers involved, facilitators involved for each PBL. Of course, we do need so many rooms, resources, and staff involved for those, ma'am.
Absolutely, absolutely. You need everybody dedicated, committed, and on board completely for such a thing to succeed. I think it was absolutely mind-boggling, but it's really amazing what you have achieved, ma'am. I just have one more query, ma'am. Have you published your experience? Because it would be extremely interesting to know for the world to have a real-world example of how it was done and how you have
True, ma'am.
achieved
Our
the whole
ME
thing.
unit, we are planning to, but we have not yet published because it's a new batch going into the first phase now. It was COVID time, and where we implemented, and we had gone through this curriculum review, stakeholders meeting, everything was, we started at 2018-19, and then we implemented it now for the 2020 batch, and they're going in for their first professional examination, which we call the final examination. So we have not yet published, but we have presented it in a number of conferences, and it's a teamwork, so it will be done as a team.
Maybe you should, because the more the documentation, people who come behind you will know how the people have started and planned this out. So it will be extremely interesting to see the entire thing in print. So I congratulate you, ma'am, and I open the floor up to questions.
Thank you, ma'am.
Please?
Thank you, ma'am. I have a small question which already Dr. Medha ma'am has asked. I just want to know when did you implement this integrated. You already answered. I think that the batch is going for the
First examination, final examination, ma'am. The batch with the new curriculum was a COVID batch, actually, the 2020 batch, we call them. So the 2020 batch will be going for their first professional examination now in December, ma'am. So we had earlier one, we had 2 assessments, end of year one, they had a professional end of year 1, they had professional examination 1, end of year 2, professional examination 2, which was the old curriculum assessment. But in the new curriculum, we have 1 assessment, which is at the end of year 2. So the new batch will be taking their first professional examination at the end of year 2, which is currently in December, ma'am.
Okay. I just wanted to know, ma'am.
Sure.
Thank you.
Thank you, ma'am.
Thank you so much, Dr. Medha and Rohini madam, for this wonderful talk. That is, integrated curriculum is the need of the medical education nowadays, and explaining nicely about that basic sciences is the foundation of the medical education, and how to integrate and how to develop the integration and not only in curriculum, we also develop this integrated assessment also. So thank you so much for this wonderful session.
Thank you very much,
Thank
Dr. Rohini, and I thank you, the organizers, for this wonderful opportunity and the wonderful interactions. Thank you so much to the organizers, and now I'll hand it over back to the organizing team. Thank you.
Now I would
Thank you,
like
ma'am. It's an
to
honor to present before you. Thank you so much, ma'am.
present a virtual memento and certificate to our speaker, Dr. Rohini. Thank you so much, ma'am. Also certificate and memento to Dr. Medha. Thank you so much, ma'am.
Pleasure, ma'am. Thank you all.
Ma'am, when we decided on the topic and the speaker, we had me and Sashmita ma'am, we unanimously decided that the chairperson should be another biochemist and an MU specialist, Dr. Medha ma'am. I thank both of you, ma'am, Rohini ma'am and Medha ma'am, for accepting and giving us a wonderful
Absolute
session.
pleasure.
Thank you, ma'am. Thank you.
Thank you so much. So much to learn from you all. Thank you so much.
Bye.
Absolutely my pleasure. Have a good day.
Thank you.
Happy learning.
Thank you so much. We'll move on to the next session. So be with us.